Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to my clinic this evening. Today we're going to talk about fallopian tube, and we're going to talk about how you can achieve pregnancy and become a mother despite the diagnosis of blocked fallopian tubes. And I'm going to make this as easy and elemental as possible. So I'm going to make it very simple so that you can understand what's going on. So this is a beautiful structure that a woman needs before she can be a mother. Now, every singular person in the clinic that has this is a constant reminder that you're a mother, despite the challenges you're having. So when you join the clinic, introduce yourself, tell us where you live. I can see Tosi and other people joining, so just make yourself comfortable. My first 15 minutes is going to be my presentation. Then afterwards, I will sit back and take care of your questions. Immediately after this clinic, please join me in Facebook group and page so we can repeat exactly this topic for our audience in Facebook. Now, every woman has two fallopian tubes. Your fallopian tubes are very important in the natural process of achieving pregnancy. For you to become pregnant, your partner must ejaculate at the peak of sexual intercourse. The content of the ejaculate is called the semen. Inside the semen is the sperm. It must swim past the cervix, which is the junction between the vagina and the womb. When the sperm gets into the womb, the sperm will permeate through an opening just at the upper end of the womb. Then it will go to the tubes. Expectedly, the egg should have been released from this end. The egg would have entered through the side of the tube, and a special place called the ampulla. The egg and the sperm will meet. The union of the egg and the sperm is called fertilization. The outcome is called an embryo. That's the origin of pregnancy. So unfortunately, in some women, they might have adhesions or scar tissues or damages or growths, which can affect the function of the tubes. When the tubes are affected, they can have different levels of blockages. You can have mild blockage, or you can have moderate blockage, or you can have complete blockage. Of the three types, the best type of blockage to have is mild blockage, because if you have that, when you go for your investigative process of checking the state of your tubes, the procedure will open your tubes. So women that have mild adhesions, mild blockage, mild hydrosalpinx, mild accumulation of fluid, when you go for hysterosalpingogram, which is the test we normally conduct to check the state of your wombs, it will open your tubes and your tubes will be okay. If you have moderately blocked tubes, that's a different ballgame. Some women might benefit from micro-invasive correction. So if you have adhesions, or if you have scar tissues, or if you have a growth, and you have access to a facility that can take care of this carefully, a micro-invasive surgeon can enter inside the damaged tube and reconstruct the damaged tube or remove the damaged parts, and you can have an opportunity to have a healthy tube. Unfortunately, the tubes are very sensitive. So anytime anything happens in the tube, when the tube is healing itself, it will form more scar tissues. So unfortunately, for most women that will go for this type of surgery, pregnancy rate is very low. Now, if you are blessed and one part of your tube is damaged completely, but the other part is open, you can still achieve pregnancy naturally without any problems. Unfortunately, in some women, if the tubes are partially blocked, the sperm can come in, the eggs can come in, fertilization can occur. Then, unfortunately, Because the opening of the tube is not wide enough, pregnancy will start developing in the tubes. This is a complication of damaged tube. That condition is called ectopic pregnancy. We don't want that kind of pregnancy because it's very deadly. Pregnancy is not supposed to develop in the tubes. Pregnancy is supposed to develop in the womb. So if that happens, we have to find out pregnancy and end it immediately. Now, if you are unlucky and your two tubes are blocked, can you still become pregnant? Yes. What do we need? We need to forget everything about the tubes and resort to a different way of getting you pregnant outside your body, which is called IVF, in vitro fertilization. So what you actually need to become a mother are your ovaries and your healthy eggs. Because when your two tubes are blocked, we can collect the eggs. We can collect your partner's sperm. We can get both of them fertilized and reintroduce it back into your body through the process of IVF. So every woman out there, regardless of the type of tubal blockage you have, you still have a pathway to becoming pregnant. Now, your level of blockage is only unique to you. No two women can have the same level of tubal blockage. So if you have a mild blockage, it might be mild unilateral blockage. That means mild one part of the tube is blocked. The other part is still open. You can still become pregnant. If you have a moderate blocked tube, then your application of your management will be based on the moderate level of blocked tubes. There is actually a medical process we call hydrotubation or flushing, which you can apply if you have a moderately blocked tube, so it can open that blocked channel so your tubes can be open. Now, some women can also have a condition we call hydrosalpinx. Hydrosalpinx means there are accumulation of fluid inside the tube, and once the fluid is accumulated in the tubes, the opening of the tubes will narrow down to the extent that it will not be open enough to allow normal pregnancy to happen. Hydrosalpinx can happen to some women, and it can also lead to tubal disorders. Now, what are the likely things that can lead to tubal damages? Pelvic inflammatory disease, sexually transmitted infection, especially chlamydia and gonorrhea, endometriosis, some types of fibroid, or any surgical process we've had on the tube, or previous ectopic pregnancy. These are the likely things that can lead to tubal damage. So top on the list of things you can actually prevent, which can lead to tubal blockage, is what? To avoid sexually transmitted infections. So if you have the predisposition of developing sexually transmitted infections, avoid it. If you happen to contract sexually transmitted infections, we need to treat it properly so that it will not further cause pelvic inflammatory disease, which can block your tubes and reduce the opportunity of becoming pregnant. Now, can you prevent tubal blockage? Yes. What can you do? By being conscious of everyday decision you make? Because how you treat your vagina will affect how you treat your cervix, will affect how you treat your womb, will affect how you treat the tubes. So anything that enters your body as a woman must be edifying. You have to keep your body clean. You have to make sure you don't contract infections, because any of them can affect your ability to keep your tubes healthy. This is about the only thing you can do. Majority of the problems you might have in your tubes are not preventable, but you need to be on the lookout for that. So the concept of going from one place, they will promise you to open your tubes when you have completely blocked tubes. It's not wise. It's waste of time. It's waste of resources. It's waste of your age, especially if you're 35 years and above. You don't have the liberty of going to a place you will not get results. Now, remember, once you have a healthy tube, one, you can still produce egg from the other side of the ovaries, and they can still travel and enter the healthy tube. Now, unfortunately, women that have ectopic pregnancy, we have to remove the entire part of that tube through the process of salpingectomy, because when you have ectopic pregnancy, is an emergency, your life is in danger. And for you to have a chance of becoming pregnant in the future, we cut off that part of the tube and safeguard your ovaries, and you have one tube remaining. And with one tube, you can still become pregnant, including having your twins. So many of our members out there who are worried, oh, will I ever become a mother? They told me my tubes are blocked. Guess what? Yes, you can. You can still become a mother in 2023, but what you need is to understand your own individual tubal blockage, understand things we can do differently to manage it. Some women might not do anything. You just need to present yourself for HSG, and HSG will open your tubes, and you can improve the possibility of achieving natural process. So by default, hysterosalpingogram procedure is one of the ways of improving your fertility, because if you have a mild blockage prior to your infertility, that mild blockage is going to take care of itself. Then you will improve your fertility if you expose yourself to regular lovemaking. So this in a nutshell is how you can defeat tubal blockage, tubal damage, ectopic pregnancy, and what have you. And you can still succeed in becoming a mother in 2023. So thank you so much. I'm going to open the clinic now, and I will allow you to ask me questions before I go. So go ahead and ask your questions. Feel free and ask your questions. I'm open to take care of your questions, please. Do you have any questions? Okay, I'm not seeing any questions yet, so I'm just going to sit back. And if you have any other question outside this particular topic, please feel free and ask so I can provide you feedbacks. Remember to join me immediately after this clinic. If today is the first day of attending my clinic, my name is Dr. Chudi Ufondu. I'm the convener of this group. I'm a fertility expert. I reside in America, and I've been on this for a very long time. And my intention is to use this channel to help a lot of women who are currently having challenges becoming mothers, to help a lot of men who are currently having challenges becoming a father. So we have so many healthy, helpful videos out there that will help you to get the knowledge you need, so you can change your attitude and begin to practice better, so you can become who God said you will become. So remember to subscribe, hit on the subscription button. We normally show up on Tuesdays, 6:30 p.m. Eastern Time. Then on weekends, on Saturdays, 12 p.m. Eastern Time. So anytime you show up, you will have something to fall back on. You will have something to share with your community, and you will have some information that will help you to improve your chance of becoming a mother and a father soon. Okay? All right, so I can see we don't have any questions for today. So I'm going to be ending this clinic now. And I want to thank you for joining. And I hope to see you guys back on Saturday. Until I see you, God bless you and enjoy the rest of your evening. Bye-bye for now.